An epidemic. That is how doctors are describing what is becoming a boom in joint replacement surgeries.
And this morning, News 13's Victoria Dunkle is live at Party Hospital. So what is leading to the spike in cases, Victoria?
Well, the fact that the baby boomers are turning 65 at the rate of about 8,000 a day. Last year we saw our first baby boomer turn 65, and for the next 18 years we're going to see that rate of about 8,000 a day. And doesn't even necessarily mean that you've done a lot to try to bring on an injury. Just the fact that we are living longer means we're using our joints more and they're wearing out. Dr. Amal Doss has been talking about it. In fact, last time we were here in the last half hour, you showed us what happens with the cartilage. But now you're going to show us a little bit more about what's going to go on, and also you have some examples of what you are taking out and what you're replacing, right?
Right. Let's have a little fun. Okay. First of all, this is a normal hip. Now, normally the hip is a ball and socket joint. Here's the ball, here's the socket, and the ball doesn't touch the socket because of the cartilage, this in orange and fuchsia. In a typical arthritic hip, you have no cartilage, you just have bone rubbing on bone. So the bone of the ball is rubbing on the bone of the socket.
Okay, and I'm going to warn folks, what you're going to show us here, maybe a little, if you have a queasy stomach, I'm just warning you, but you're actually showing us what you work with every day.
So what I want to show you is a hip ball from a patient who has arthritis of the hip and has had their ball removed. Somebody get the smelling salts ready in case Victoria drops here. Let's see if we can.
I'm looking away, folks. I'm telling you right now.
Come on, Victoria.
I'll be a brave girl.
All right. So the first time you see this, you understand what arthritis really is. This is a hip ball, and that ball should be covered with nice, smooth, beautiful, white, glistening cartilage. Here's some cartilage here, although albeit it's not very heavy. Look here. All bone, and you can see that mechanically that cartilage is just worn away.
You do, when you take, and you see how many patients a week do for joint replacement?
We do about 7 joint replacements a week. 7
a week, and you're helping them out by bringing in some of the technology and some of the great materials that are here in place to help us, right?
That's right.
How about in our next half hour we break down some of the advances here that are really helping the recovery rate go way quicker, way more smoothly.
Hey, I've got an idea.
What's that?
Why don't we show how to fix this problem right here?
I love it. We'll solve the problem for you in our next half hour. Reporting live in Hendersonville, Victoria Dunkle, News 13.